nurses, did I catch you at a great time to study? Hey, I figure we're all home. We can't go to school. We can't go to our jobs maybe. So we might as well take this opportunity and get a power study session in. So this is for all of my nursing students who are studying with me at the virtual trainer location. All right. So I wanted to go over some of the information that comes from the REMAR program just to make sure that you guys are doing what you're supposed to be doing. So, hey, come on in, everybody. It's time for a power study session. I'm going to actually be asking you some questions from the REMAR NCLEX review, and I hope that you know them. I just have a couple flashcards here. So what I would love for you to do is to take out a sheet of paper. I'm going to ask you the questions, write down the answers on your paper, and then at the end, I am going to reveal the answer. So I just got a quick 15. Is it 15 or 16? 16 question quiz, okay? So this is general NCLEX things that you need to know. And if you don't know them, then we know we need to study some more. So one of the reasons, hi everybody. One of the reasons why I'm doing this is because it is very easy for us to look around at everything that's happening and then feel discouraged. So whatever we can do as a community to uplift each other and keep each other focused and keep you guys motivated. Shout out to everybody that just joined the virtual trainer, taking advantage of the flash sale as well. Right now we have the VT on sale from $169. We dropped it down to $149. Remember, it was originally at $300, but we dropped it down to $149. And if you have the 5-star quick facts, it's just $129. So check out remarnurse.com for more information. But we're about to get into this study session. I'm waiting for my nurses to come on in. What you need to do, I'm in my home classroom. What you need to do is take out a sheet of paper or mentally just say to yourself the answers. And I'm going to begin. I got my flashcards here for you guys. Oh, one more thing. Go ahead and ask me questions about the REMAR things as we are doing this. All right. Because then I will for them. If you have placed the order, it's coming. It's coming. Get ready for your flash quiz that's happening right now. This is for RN and PN. The questions I'm going to ask right now are for both. All right. You need to know both. Okay. So are you guys ready? This will be like a feel of having a buddy, a study partner with flashcards, okay? So again, if you ordered the virtual trainer book, it's coming to you. We are still able to ship it out to you guys, so we're doing that. Should we focus on the new quick facts from VT or a combo of both? I would say, hey Reagan, I'm so glad you're here. Okay, that's a good question. And then I'm going to get into the quiz. I promise the quiz is coming. I got the flashcards right here for you guys. I would say if you had to focus on anything, I would start with the lecture material in the virtual trainer, because this really, with the virtual trainer, I'm able to create like a picture of nursing for you guys. And when you have that foundation, the foundation comes from here. When you have the foundation of how, to prioritize, how to manage a person, when you understand the diseases, then you can put in facts into that house of knowledge. But if you are just trying to memorize facts and things and you don't really have a structure in your mind to put it in, I think it could be more challenging. All right. So that's my thing. Get in the virtual trainer, get started there. All right, another thing, I'm in Ohio right now. I don't know where you guys are living, but be safe out there. Things are definitely changing. In our environment. So as we're going out to grocery shop and to study and all those things, be careful and be safe. I'm actually working from home today. So that's why I'm in my home classroom. You guys can see it. I homeschool my daughter. So I already have a classroom environment at home. So when I'm not schooling you guys, I'm schooling a kindergartner. Okay, so here we go. All right, Carol and Marilyn, here we go. Are you ready for your quiz? All right, get out your paper and write it down. I really don't want to see any answers on the screen. I want everybody to be able to do it. As you can. And if you have the old quick facts, you can study the old quick facts as well. The original quick facts is just fine. It's just fine. But I did update the new one and add some new topics to it as well. Okay, so we're about to do a quiz. I want to keep you guys motivated. I want to keep you guys encouraged. We can still study. Even if we can't take the test, we can still be preparing. Okay? So question number 1, you either know it or you don't. Okay? Question number 1, does aspirin increase or decrease the effects of methotrexate? This is pharmacology for you guys. Number 1, does aspirin increase or decrease the effects of methotrexate? Okay, that's question number 1. You either know it or you don't. Okay, what is methotrexate? All right, just think about that. Question number 2 is here. It's this. Is meningitis considered an opportunistic infection? Is meningitis considered an opportunistic infection? Okay. All right. We're going to go over these answers. I'm not giving you the answers now. I'm going to give you the answers after we do question 16. Okay. I'm on question number 3. If you just joined in, we're doing a pop-up quiz for NCLEX. Question number 3. Is digoxin given in Adam-Stoke syndrome? Is digoxin given in Adam-Stoke syndrome? Okay. All right, here we go. All right, no answers on the screen, please. We're writing our answers down. We're just taking a quiz. We're just seeing what we know, what we don't know. So I'm not going to give you guys the answers right now. I just want to see if you know the information. So think about it in your mind or write it down on a piece of paper, okay? Question number 4. Which position is best for appendicitis? If a patient has appendicitis, what's the best position for them? That's cool. Okay. All right. I'm moving on. This is a good one. And this is, you know what, guys, this is just an opportunity to use the language, use the medical terminology in your everyday life. I want you guys to be hearing it. I want you to say, well, wait, what did she say? I never heard of that before. I need to go look that up. All right. Question number 5. In pernicious anemia, what will the tongue look like? In pernicious anemia, what will the tongue look like? Yeah. What's pernicious anemia? What's another name for pernicious anemia? Anybody know? Good stuff. We are on question number 6. This is pop-up NCLEX study time. We need it. Question number 6 says, it says, which is the most common cause of autonomic dysreflexia? Yeah, which is the most common cause of autonomic dysreflexia? You guys know autonomic dysreflexia. There's many things that can cause it. There's many things that your patient could be experiencing, but which is the most common cause? Don't put it on the screen. Don't type it. I don't want to see. Other nursing students don't want to see the answer. If you know it, you know it. That's great. Don't tell us the answer. We want to know for ourselves. Okay. Hey, I'm talking about the virtual trainer. This is how we study. It's so cool to be able to study virtually. Look what we doing. Look what we doing. We are studying together as a community right now. I don't know if this is taking place anywhere in the world. So I'm happy that you're here because I think that this is probably the only NCLEX review that's happening right now. And you made it. All right. Question number 7. Put my cards here. Oh, what is the most common infection spread through blood transfusions? What is the most common infection spread through blood transfusions? Interestingly enough, this information is very vital. This information is very vital if you'll be taking NCLEX after April 16th. All right. And that's probably all of you right now. Hey, we are having an NCLEX review right now. Question number 8. I'm moving on. Question number 8 is bipolar disorder a risk factor for hypertension? Is bipolar disorder a risk factor for hypertension? No answers on the screen. Just think about it for yourself. That might be a tricky one for some people. Okay, I'm moving on. We on question number 9. I only have a few questions for you guys today. Question number 9 is this. And we're going to go over the answers at the end, but just think in your mind or write it down. Which herbal medication is used to lower blood pressure? Which herbal medication is used to lower blood pressure? There are many types of herbal medications and patients use them for all type of things. But which one is used to lower your blood pressure? Okay. Write your answers down on your piece of paper. We're going over them at the end. For everybody that's just joining us, we're doing a pop-up flash NCLEX quiz. All right. Hey, I'm on. This is a good one. Question number 10. What does the letters DASH stand for in regards to the DASH diet? Well, we all have heard of the DASH diet. That's the cardiac diet. Well, what do the letters DASH stand for? They stand for something. We just don't call it DASH for a reason. What do those letters stand for? Okay. I know that's a good one. Okay. If anybody knows that just off the top of their head, you've been really doing some studying. All right. Question number 11. Are you guys ready for question number 11? Hearts on the screen if you like doing these pop-up quizzes, because I've never done this before. So let me know if it's working for you, if you're feeling this. We could do this more often if you guys like it. Question number 11. Relaxin is a hormone. Does relaxin support the release of breast milk? Okay. So think about breastfeeding. Does the hormone relaxin play a part into that? Look. I'm putting the pressure on you guys. You say you've been studying? Hey, you say you've been studying? Let's study. Okay. All right. Ready for question number 12? We're on question number 12. We're only going to 16 right now. Okay. Question number 12. And this is how you study when you have kids, because my 2 kids, they can bust in here at any time on me. I mean, we got to do this as quickly as possible. All right. Question number 12. Is Buerger's disease painful? Is Buerger's disease painful? Question number 12. Is Buerger's disease painful? What is Buerger's disease? Do you even know what that is? What happens to a patient who has Buerger's disease? And would it be painful for them? Okay. Question number 13. Okay. Question number 13. Chemotherapy. Oh, okay. This is a true or false. Okay. Question number 13 is a true or false. All right. Chemotherapy destroys the cell membrane. Is that true or false? Chemotherapy destroys the cell membrane. Oh, that's a good one. That's a good one. We know it destroys some part of the cell, right? Because I know that I wrote it in your studies. I wrote it in your study. But what part did I write that chemotherapy destroys? It's in the details. It's in the details. All right. Okay. Question number 14. I'm moving on. Question number 14. This is about cataracts. Okay, cataracts. So when removing a cataract, will the client's vision be corrected? Will it be? Or, are we just removing the cataract? Or will the client's vision be corrected once that cataract is gone? All right. Shout out to Jessica Gonzalez, Team Remar, helping me on this live feed, answering your questions. I appreciate that. You guys, I'm at home. It's not possible. All right. So here we go. Question number 15. I'm moving on. Question number 15 says, what is celiac sprue? What is celiac sprue? What is that? Have you heard of it before? What is celiac sprue? All right. And don't worry, we're going over all these questions. We're going to be able to get some stuff in, get some little quick education in so that, every day we're doing something towards our goals. It's easy to say, I'm going to study this week, but when are you going to study? How long is it going to take? All right. Last question is this. Is a pulmonary function test a way to diagnose cystic fibrosis? Is a pulmonary function test a way to diagnose cystic fibrosis? Okay. Questions. Those were our questions for today for our pop-up quiz. So let's go over the answers quickly. You must pass NCLEX. All right. And again, this study session is brought to you by the NCLEX virtual trainer. My favorite resource on the planet right now. Keep us all studying and engaged together. I was in there last night, had a great time. All right. So here we go. All right. Number 1, I'm going over the answers now. So now you guys can feel free to type the answers because some of you weren't listening and you were putting the answers up on the screen. The first question was, does aspirin increase or decrease the effects of methotrexate? All right. What do you guys say? Does aspirin increase or decrease the effects of methotrexate? What do you guys say? All right. Put the answers down. And remember, methotrexate is are you guys there? Okay. Are you guys there still? Yes. Methotrexate is considered a chemotherapy drug. All right. Oh, that was Mark. He's probably gonna wonder where I am. All right. Well, he'll see this live video later. All right. So methotrexate can be used for chemotherapy, but also remember when I did the Love Your Content pregnancy review, methotrexate can also be used to dissolve ectopic pregnancies as well. So study that medication. All right. Okay. The next question was, is meningitis considered an opportunistic infection? Is meningitis considered an opportunistic infection? Well, yes, it is. Yes, it is. If you have your quick facts book, it's definitely in there under the HIV section. So if a client has transitioned into having AIDS or are immunocompromised, it is easy for you to get a form of meningitis. Okay. All right. Question number 3. Is digoxin given in Adams-Stoke syndrome? Adams-Stoke syndrome. All right. So Adams-Stoke syndrome, what kind of issue is that? What kind of syndrome is Adams-Stokes syndrome? Put it on the screen. I expect my Remar nurses to know that. Number one was I apologize. Number one was increase. So aspirin does increase the effects of methotrexate. Sorry about that. It does increase it. So just to recap, number one, aspirin does increase the effects of methotrexate. 2, is meningitis considered an opportunistic infection? That's yes. 3, is digoxin given in Adams-Stokes syndrome? And yes, that is also correct. Usually it's given after surgery. Adams-Stokes syndrome is the heart problem. Yes, it's the cardiac issues. Yes, great job, great job. And so what I'm trying to show you guys is that this is an effective way to study. This is a great way for us to study topics and it not be boring or it not be, unproductive. And so, yes, you can give digoxin for patients who have cardiac problems because digoxin is very good to do what? What does digoxin really help the heart to do? We know that most people say, well, it slows down the heart. Yeah, it slows down the heart. It's a cardiac glycoside. It slows down the heart, but it really allows the heart to pump more intentionally, pump more forcefully, right? So that more tissue perfusion can be created with each heartbeat. So yes, you can give digoxin in Adams-Stokes syndrome. If you knew that that was a heart problem, well, that makes it a lot more easier to know whether there's a connection between the two. But if you don't know what Adams-Stokes syndrome is, then it's going to be very hard for you to answer these types of questions. And so it really goes back to that content. All right. Awesome. I love Nurse Marcel says, I love the quick facts. Even when I passed, I'm still learning. Yes. Okay. Question number 4 is kind of simple, kind of easy. Put the answer on the screen. Which position is best for appendicitis? Which position is best for appendicitis? What saith you guys? What saith the Remar nurses? If a patient has appendicitis, which is inflammation of the appendix. Do we need the appendix? Is it like an essential organ, or can we remove the appendix pretty, it's something that can be removed and the patient can still live? Yes, absolutely. I don't want to say the appendix is non-essential. I don't think that's the truth. But if it becomes a problem or if it becomes inflamed, doctors usually do not hesitate to just take that thing out. All right. So the position for it, do I see it on the screen? The position for it is actually semi-Fowler's position. All right. That's going to be the best because semi-Fowler's, why it's so good is because you're like kind of propped up, but it relaxes your abdominal content. So if you have pain, right, in the appendix, you are usually guarded, you're like tight. Okay. But when you're in the semi-Fowler's position, it allows you to relax that abdominal area. So it's very helpful. Okay. Question number 5. If you were taking notes, the question was, in pernicious anemia, what will the tongue look like? And I asked you guys, what was pernicious anemia? What did it mean? What was it? So that's vitamin B12, right? It's a vitamin B12 deficiency. It's anemia. And the answer is it would be a beefy red tongue. A beefy red tongue. All right. Good job. Some people knew that. All right. Question number 6. Question number 6 is this. What is the most common cause of autonomic dysreflexia? Pop up NCLEX flash quiz to go with the flash sale for the virtual trainer. The most common cause of autonomic dysreflexia. Hi there, if you're new. This is what we do. We study NCLEX. We talk NCLEX. We make it a part of our daily life. So autonomic dysreflexia, what is that? I mean, what type of patients get autonomic dysreflexia? Do we expect cancer patients? Would a cancer patient have autonomic dysreflexia? Do we see autonomic dysreflexia in women who are menopausal? Like, what is the population that has autonomic dysreflexia? This is how you study. This is how you study, right? Let's just talk about it. What does it mean? What happens here, right? So usually clients with what kind of injuries suffer from this autonomic dysreflexia? Usually clients with spinal cord injuries, right? Spinal cord injuries. And there is a stimulus that if it doesn't get resolved will cause their blood pressure to go haywire. It's very, very interesting. It really is. It's very interesting. So anyways, the most common cause of autonomic dysreflexia is urinary obstruction. Yes, a full bladder will cause autonomic dysreflexia, okay? And also fecal impactions or constipations will cause it as well. Tight clothing, restrictive clothing, those things can cause it. But it's so interesting. If you haven't really read about autonomic dysreflexia and maybe you just studied it in quick facts, or you studied it briefly, take some time to really dig down into this condition because I think it's very important for every nurse to understand how to work with spinal cord injury patients, whether you see them frequently or not. It's just good information to know. Okay, we are on question number 7. Question number 7, I asked, what is the most common infection spread through blood transfusions? What is the most common infection spread through blood transfusions? What do you guys think? Is it HIV? Is it syphilis? Is it varicella? Is it hepatitis C? What is it? What do you guys think? Is it MRSA? What is it? Okay. All right. And so I see the answers on the screen, guys. And what I will say is that if you find yourself getting most of these questions wrong, that's okay. But what you need to do is just do a self-assessment and just determine, hey, am I really studying like I'm supposed to be? Or am I just allowing my memory to try to work for me? Okay. The correct answer to the most common infection spread through blood transfusions is hepatitis B. Okay. Hepatitis B. All right. So we always should be evaluating ourselves to see, do I know what I'm supposed to know? Have I been accountable to my studies? Have I been accountable to this process? All right. And that's cool. And it's cool if you're on here and you're like, oh man, I don't know this stuff. Hey, that's all right. All right. Because you don't know what you don't know until you don't know it. All right. And we never want that to be when you're taking your NCLEX and you're like sitting there like, I don't have it. All right. Okay. Question number 9. I see some people putting the answers up there. Which herbal medication is used to lower blood pressure? Is it ginger? Is it echinacea? Is it dandelion root? Is it feverfew? Is it black cohosh? These are all herbal medications. You better know. All right. Is it garlic? Is it garlic? Yes, it's garlic. All right. But you got to know the herbal medications and what they are used for. All right. So, and it's so easy. I'm saying this stuff. It's so easy to have known it at one point in your life. And then because you haven't studied it in a long time, you forget it. That's all. That's it. That's what happens. All right. Did I skip 8? Oh my goodness. Thank you so much. I sure did. All right. Okay. So I got to go back to question 8. That's fine. I just did number 9. Question 8 was this. I'm on question number 8 now. Sorry, guys. Okay. So question number 7 was, what is the most common infection spread via blood transfusion, and that was hepatitis B. So question number 9, oh no, that was question number 7. Oh my goodness, let me slow down. Question number 8 is bipolar disorder, that's what it is bipolar disorder a risk factor for hypertension? Is bipolar disorder a risk factor for hypertension? And that is going to be a big fat no. No. Okay. And I wanted to confuse you guys, because anxiety is a risk factor for hypertension. Anxiety is, but bipolar disorder is not. So I just tried to switch a mental diagnosis out, and then see if I could trick you guys. So did you get number 8 right? The correct answer is no. Bipolar disorder is not a risk factor for hypertension. It's not. Anxiety would be, if you're African American, race would be. If you are overweight, that would be a risk factor, right? Okay, I'm looking through the VT workbook right now. Okay, question number 9 I did, but I'll read it again for consistency. Which herbal medication is used to lower blood pressure? It is garlic. Okay, question number 10. Question number 10. What do the letters dash stand for? DASH. What do the letters dash stand for? And don't try to tell me if you looked it up. Like, I don't want people that looked it up to write it down. Like, did you really know it or did you not know it? Okay. Question number 10. What do the letters dash stand for? And if you didn't know it, I want to know who's brave enough to say, I just did not know it. Like, I didn't know it. And I'm glad I didn't know it, because now I'll look it up, or I'll make sure I know it. Sometimes it's easy to read something that seems so familiar. Like, oh yeah, DASH diet. Oh yeah, cardiac diet. But what do those things mean? What do those things mean? Because those are the type of things that NCLEX asks you. They asked you one step behind the recognition. Like, so you can recognize something, but if you don't take the next step, then you can be feeling a little insecure in that information. So the correct answer is dietary approaches to stop hypertension. All right. Naisha says, I didn't know it. Okay. All right. I like that. No, you know what? I wanted to put some things on here. I wanted to put some things on here that you guys, would not have probably thought of. That's why it's important to have a study partner. Emanuela says, I have no idea what DASH is. All right. Actually hearing it the first time. I love that. That's so cool. That's so cool. That's why I'm glad you're here. All right. Yolanda, I didn't know it. Regina, now I do, since I looked it up, and out is dietary approaches to stop hypertension. Yes. Okay. So some of these things I had got from Quick Facts. Some of these things I got from the virtual trainer workbook. This next question, question number 11, does relaxin support the release of breastfeeding? Okay. Support the release of breast milk that comes during breastfeeding. Does relaxin, the hormone relaxin, yes, the hormone relaxin, does it support the release? Does it support the release of breast milk? Okay. Does it support the release of breast milk? Relaxin. So think about what hormones are released. Does anybody know what hormones are released during breastfeeding? Hey, CNA, that's what, I love it. I'm so glad you're here. Yes. And you know what? If you're a CNA and you plan on going back to school, this is perfect. This is the perfect place for you to be, because we're talking nursing things. So if you can catch on to the language, if you can follow me, then you can do it. You can do it. Okay. So, relaxing. I see everybody saying yes. I don't know why y'all saying yes. I have no idea why you guys think that this relaxin supports the release of breast milk. You guys know good and well that that's not the right answer. I'm sorry, it's not. Prolactin and oxytocin are what is used in breastfeeding, okay? Not relaxin. Relaxin is a hormone, yes, but relaxin is used to expand. I'm not even telling you guys. You know what? I'm not even telling you what relaxin is used for. Somebody look it up. Somebody who didn't know, look it up, all right? And put on here what relaxin is used for. All right. Yeah. Okay. So the labor and overview. I think the labor and overview points in the virtual trainer. Pregnancy is one of the first. Pregnancy is. Can I see it? Pregnancy is one of the first topics that I start with in the virtual trainer because clinically, if you look at a patient, there is nobody sicker than a pregnant woman. Okay, there is nobody more critical than a pregnant woman. And we have these misconceptions about pregnant women that, oh, they're all right. You know, sometimes they complain about their back hurting or whatever. But when you are pregnant, it is the sickest you will ever be in your life as a woman. Okay, you are anemic. Okay, because you're growing another human. So your red blood cells, your nutrients, all diverts from you to the thing that's growing inside of you. You're anemic. You are constantly hungry. You're malnourished because even though you're eating all the time, what's happening? All that energy is going to grow the baby. So you're hypoglycemic. Your blood sugar is low. You're dehydrated most of the time. Your iron is low. So the pregnant woman is one of the most complex patients walking around on this earth, but you would never know it from the outside. You would never know it by just looking at them, right? And so it takes a very sophisticated look at all of the health disparities and all the health challenges that a woman has during this short period of time. The body goes through massive changes within, about 10 months. And so I love to start at pregnancy whenever I do an NCLEX review, because once you can understand the challenges of those changes, then I think it helps to introduce the rest of the lifespan to a student. All right. I say all that to say that relaxin does not have anything to do with breastfeeding. Okay. Question number 12. We're doing a pop-up quiz. Question number 12 is Buerger's disease painful? Is Buerger's disease painful? What happens during Buerger's disease? What will your patient have? What will be their challenge? What will be the teaching of the patient with Buerger's disease? There's another name for Buerger's disease. If you know what it is, go ahead and put it on here. Consider says, so good to still be here after passing almost 8 months now. Wow. Miss Regina, I love this platform. Hey, thank you for being here. Wow. That's amazing. 8 months. I saw a couple other nurses pop on here. Shout out to all the registered nurses who are watching right now, ready to, I guess you may be ready to go into work. Maybe you're ready to get off. Stay safe out there, all of the nurses and healthcare workers in the hospital right now. It's not a good place, all right, to be if you don't have the right protective equipment on. Man, it's crazy out here. All right. Yes, thank you. I see all of the teaching. I love it. I love it. Yes, we tell our Buerger's disease patients have issues with vasoconstriction, right? They have issues with their hands. Their hands will be turning blue right in front of your eyes, white or blue. Yes, love the comments. Buerger's disease. We're talking about Buerger's disease. You may or may not have heard of it before, but understand this. There's so much teaching involved with a client with Buerger's disease because they're scared. Imagine looking at your hands and they're totally blue. They want answers, all right? Hands and feet, totally blue. And so, yes, it may be painful. Some people don't feel it at all. Other people know, like, oh, man, my hands are changing. It's starting to hurt, okay? So there we go. All right. 13. I'm moving on. You guys are doing really, really good. Maritu, am I saying it right? Hi, everyone. I passed NCLEX March 14th, 20th Wow. Thanks, Regina and NCLEX family. Much love. 7 months pregnant and a LPN. So proud. Woo, you just made it. You just made it, lady. In the nick of time. My goodness. That's a good feeling. Now you can have the baby, relax in peace. Congratulations to you. It's a wonderful thing to have your nursing license. Shout out to you. Wow. All right. 13 says chemotherapy destroys the cell membrane. Is that true or false? True or false? All right. Cell membrane. Is it the cell membrane or not? Okay. No, actually, that's false. Chemotherapy destroys the cell wall. It destroys the cell wall, not the cell membrane. The cell membrane is different than the cell wall, isn't it? Isn't it? Or is it not? Yes, absolutely. It's totally different. Nurse Perez, shout out to you. Thank you so much. I'm reading the comments. I love the comments. I passed my LPN NCLEX with you 2 years ago. I'm doing my RN program now. This is so wonderful. Thank you for everything. That is, wow. Shout out to you for going back to school. All right. Nobody wants to do that. It's tough. It's challenging. So I applaud you. All right. Nurse Petros, future Nurse Petros. I'm in my kitchen cooking, listening to your teaching. That's right. You in the kitchen cooking it up. All right. We got to do something while we home. These kids is hungry. My kids are not in school. They're eating up all of the food. Oh my goodness. All right. Here we go. So, anyways, chemotherapy destroys the cell wall. It destroys the cell wall. The thing about chemotherapy, though, that we understand, and the thing that makes it so challenging for our patients is that it destroys the good and bad cells. So it doesn't discriminate between what's supposed to be there and what's not supposed to be there. And so when our patients are on chemotherapy, we know that they are extremely immunocompromised, right? And I'm not laughing because they're immunocompromised. I'm laughing at these comments about the kids being home. All right. Yeah, so our patients who are undergoing chemotherapy, they need the utmost care, and they should absolutely be isolated from anything that can give them that can be a source of infection, whether it's visitors, whether it's live flowers. We got to watch the vegetables and things that they're eating, because bacteria essentially live everywhere, and they don't have the immune response to be able to fight off things that we encounter every single day. Especially, nobody's yuckier than a healthcare worker. I don't care. Nobody is more a disease. I don't even know. We as healthcare workers, most of us, and you guys know, most of us, we carry MRSA on our skin. We have it on. I know I have MRSA living on my skin. I just know it. You get it from the hospital beds. You get it from, just going in and out of your patient's room. It's all over you. And because we're so healthy, it doesn't bother us, right? So most healthcare workers have MRSA in their nose, on their skin. And so we have to be very careful to protect our chemotherapy patients from ourselves, because we're pretty gross. The shoes that we wear, the uniforms, it's just what it is, right? When you become a nurse, that's part of your that's part of the exchange. Yes, you make a lot of money, but now I think more than ever, people are seeing that guess who's on the front lines of the real situations? It's the nurses. The nurses are every day in the situation room. And so, it takes something like the coronavirus to really show the value of an individual nurse. And that just blows my mind. So, at this time, we're not watching the entertainers. We're not watching the actors. We're not watching the basketball players or the football players. None of those people right now have the value that they had last month. You know who has the value? The nurses, the doctors, the nurses' aides, those healthcare workers. Now people see, okay, when you strip us down of all the artificial and superficial things, and I'm not talking about, entertainers, craft. They have an art that they do. But when all that goes away and we don't have time for, entertainment because we're worried about our lives, the real heroes stand out. Okay. And let me get off my hobby horse. All right. For now. I failed at 200. Here's the comment. I failed at 265 questions on my second attempt. I brought this to study for my second attempt. I'm torn on what to do now. Okay. Keep on studying. Listen, it seems like to me you may have only tested 2 or 3 times. We don't even blink at that. I mean, we have people who have tested multiple times, 7, 8, 9, 10 times. So just keep going. Don't give up. Don't give up on yourself too early. Okay. Don't give up on yourself too early. And I like that. Keep going for that third attempt, no matter what. Just one of the things is if you stop now, you're going to have to live knowing that the career you're supposed to be in, you're not working in. And so every day you'll be settling in whatever you choose to do. The test is hard. NCLEX is hard. Okay. But it's not impossible. Like there's some things structurally you can do to make yourself stronger. There's some things, just consistency, studying. Don't give up. Don't give up. Study again as long as it takes. This is where you're supposed to be. Okay. This is where you're supposed to be. Okay, let me finish this quiz and then we can go back to it because I will never get this done if I keep going off on tangents. Here we go. So the last question we left off on was 13. It says, chemotherapy destroys the cell membrane. Was that true or false? That is definitely false. That's definitely false. It destroys the cell wall. So the next question is, when removing a cataract, will the vision be corrected? Okay. When removing a cataract, will the vision be corrected? And the answer to that question is no. No. The vision will only be corrected if there is a new lens that is put in place. So essentially, it's just like the vision surgeries, like, what's the name of the thing? Help me, guys, when people get the LASIK eye surgeries. Okay, so like the laser eye surgeries where they put in the new lens and then the people can see, they don't need their glasses anymore. Well, that would have to happen during cataract surgery for the vision to be corrected. So other than that, if a cataract is just removed, then no, the patient will still need their glasses. They still will have vision problems. Okay, so that's a little detail to that surgery. All right. Okay. Question number 15. We're at the last 2 questions. Question number 15 was, what is celiac sprue? What is celiac sprue? Celiac sprue. Okay. Celiac sprue is another name for celiac disease. This is another name for celiac disease. So it can be called celiac sprue or celiac disease. And you better be ready to see both of them. Okay. All right. Okay. I like that. Jeanette says cataract surgery just removes the dirty window. Okay. All right. Lewis, celiac disease. This is an allergy to gluten. Yes. As I'm saying these terms, the pathophysiology that should be coming out. Like, oh, I recognize celiac disease. Hey, I know rice and corn. All right, are good alternatives for those. Okay. And then so the last question here. Yes. The last question here is a pulmonary function test a way to diagnose cystic fibrosis? Okay. What's cystic fibrosis, guys? When you have cystic fibrosis, what is the issue that the patients have? Okay. When a patient has cystic fibrosis, what kind of issues do they have? They have a buildup of what? They have a buildup of mucus, right? Awesome. Just got the VT. Perfect. You have a buildup of mucus, right? Yes, a lot of phlegm. Yes, it's a lot, like respiratory wise, thick secretions. Oh yeah, they're very, very thick mucus. All right. Cystic fibrosis. If you don't know it, take some time and look it up, because it is a very straightforward disease process. Like, you're just going to have a lot of mucus wherever you can have mucus build up, right? And mucus is usually an inflammatory response. So if the lungs are attacked, or you get a cold, or, something similar to the coronavirus, like where, you have this virus attacking the lungs, one of the ways that the body tries to combat the virus is to send fluid there, or to send mucus there, right? But these patients with cystic fibrosis, they don't have a specific disease or bacteria that is causing the mucus. It's just like a natural production of too much mucus. So the correct answer is yes. A pulmonary function test, you would see a decreased results with the pulmonary function test to determine cystic fibrosis. You can also do a stool sample to determine cystic fibrosis as well. You can read about cystic fibrosis in Quick Facts. I do love the Quick Facts book because it will definitely give you a great skeleton of a lot of diseases that you will come across for your NCLEX exam. So that was our pop-up quiz. I don't know how long it took us today to do that, but it was a very great review. We only had 16 questions. And we went over a lot of different information. So I say all that to say, those people who are trying to do 100 and 200 questions a day, be kind to yourself. Spare yourself that trauma, because it is more important that you do fewer questions a day and really have some comprehension and really feel like you understand, as opposed to just doing a lot of random low quality questions that at the end of it, you can't even remember what you studied. You really can't. So pop-up study sessions, since we are all quarantined, we can call this our quarantine NCLEX review around here, but it is always good to assemble virtually. And so that's the point. Virtual trainer. Are you guys able to reschedule? Okay. Are you guys able to reschedule your test dates? I hope that we are in the mindset that as soon as we can take it, we take it, and that we're following the VT calendar. If you guys look at the virtual trainer calendar, it's a 6-week program, but I only have you studying 24 days out of the 6 weeks. So can you do it a lot sooner now that you're quarantined at home? Yes, absolutely. I think you can. I think honestly that so many of you can take this time and accelerate the learning curve so that now you can get your license even sooner. And so that's the silver lining in this cloud. I'm going to go back into the virtual trainer tonight. I was studying infection control. You will see next week some wonderful things in the virtual trainer. So I'm really excited for you guys that are jumping in and just starting. You're in the beginning of the program. And so as you go through it, you will see more and more confidence increasing. You guys did great today. So if you have any questions right now, and be on for a couple of minutes just doing general questions. Nurse says, please, how do I use my virtual trainer? Okay, so one of the things that I want you to do is, once you get into your virtual trainer, all right, if you have any questions about exactly how to find your virtual trainer or anything like that, email support@Remar Review. But when you get into the virtual trainer, okay, the very first thing that you need to do is the before the books arrive section, the getting started and the before the book arrive section. If you go through the getting started section, it will help you to understand the layout of the virtual trainer. Okay. So I think a lot of people skip that getting started section. I would not do it. Okay. I really would sit through those videos, because once you do that, then you are able to understand, okay, where is everything? How can I make the best use of it? And then before your books come, just go into the before the books arrive quizzes. And you don't have to do every one of them. You can skip around, but just get into the habit of just going into the virtual trainer, okay? And then when this book comes, you can begin your lectures, okay? A lot of students try to start before, okay? A lot of students try to start before comes, and they find that it's just much easier to wait for your virtual trainer book to come to watch those NCLEX review lectures, okay? I'm almost done with school. Which package do I buy? You can get the virtual trainer. I mean, the only package that I sell now is the virtual trainer. I don't sell the DVDs. Somebody asked, can I get the DVDs? I no longer sell the DVD program. So it's no longer available, okay? Let's see. It is very helpful to do the before the book arrives. Yes, it's helpful. But remember, that is just to keep you busy until the workbook comes, okay? Because once the workbook comes, then this is your priority. This is your priority. The virtual trainer workbook is your priority once the books come, okay? All right. Zambia. Okay, listening to you from Zambia. Perfect. All right. So, hey, the virtual trainer is still on sale. We are still doing the flash sale. And, you know, every time I come on here, I'm telling you guys about it because I get a new audience every day. There's always new people that are just finding out about Remar, and they're just like, hey, what is this girl all about? What is she doing on here? Why is she talking about NCLEX so much? So this is why I talk about the virtual trainer, because somebody is watching today and they have never seen this book before. And then some of you are like, yeah, that's my virtual trainer. It's scribbled all over. I have so many notes in it. But other people have never seen this before. So the NCLEX virtual trainer now is the way to study for NCLEX while you're at home. So I need clarity. Did you add more stuff to the virtual trainer? I'm adding more stuff to the virtual trainer now, but I have not activated it. I will be activating it probably Saturday night. I'll probably be activating it Saturday night. All right, so just stay tuned. And I'm adding it to the before the books arrive section, so you'll see things in there, okay? All right. Any tricks to studying pharmacology? That's a great question, Kathy Aurora, which I feel like, Kathy, I don't feel like you're a new person, Kathy. I feel like you are like a top fan. I would say right now, the Quick Facts book is the best way to study pharmacology in terms of just the layout of it. I have seen other pharmacology resources. I've seen drug books. They are extremely complicated to do. So I would do flashcards if you had to, just like generic flashcards like this. And then also I would do the Quick Facts book and just take some time and study it every day. All right. Yes, even if you have the virtual trainer, anytime I make an update to the virtual trainer, everybody who has access to the virtual trainer gets it. It's not something that only the new people will get. And I'm not, all the topics and stuff, y'all, I'm adding quizzes, I'm adding practice questions to it. So it'll be various different types of topics and stuff. Just check it out on Saturday, and you will see it. If you have the virtual trainer, Saturday, you should be able to see everything. Okay. Yes, you will get the add-ons. Perfect. So I just finished my 6 weeks, and would I still be able to get it, or I have to repurchase? No. So when you get the virtual trainer, you have 3 months access to it. You have actually 90 days. Okay. You have 90 days to the virtual trainer. So even if you did the 6-week calendar, you still have access to it for the duration of your subscription. So anything that I add new to the virtual trainer, you guys got it. You guys got it. How does someone get motivated to study after failing the first time? That's a great question it's not easy when you fail to NCLEX. It's not easy, especially when you have made the journey quite a public one, when people know that you're studying for the test, when your family is excited and they're looking for you, to be a nurse. And you think you're doing everything, you actually do. You do everything you can. I mean, some people, that's just the truth of it. They do everything they can to prepare. They study every day like they're supposed to or whatever. And then they get to the exam and you just don't pass it. You don't know the information. You never seen questions like them before. You're nervous. You're You're probably not reading everything correctly. I mean, there's many different things. You know, the NCLEX is a scary situation. It is. It's a scary situation. There's other people in the room, and so you don't pass it, right? So you fail, and then you have to go through this whole process of grief. And anybody that has been through it, you can speak to it more than I can. But there's the disbelief, there's the shame. You have to tell everybody, and then you have to really you're contemplating, like, am I doing the right thing? You're trying to look for fault, like, whose fault is it? Did I not study the right material? Did I not, did my teachers not prepare me? Did I wait too long? And so all of these things you have to go through. And literally, in order for you to be able to get motivated to test again, you really have to go through all of these feelings, because it's a process. It's a cleansing that you have to go through. Honestly, you have to, when you're ready to take that test again, you cannot think of 1 second of that last exam, because if you do, you're already setting yourself up for failure. Like, every time you take the NCLEX, it has to be a new start. You have to have a totally fresh outlook on the situation, because you're going to get a new exam again. You're not going to get those same questions. I just want to plug up my phone so it doesn't die. You're not going to get those same questions again. You're going to get a totally new test. So what it takes for you to get motivated is for you to find why. Why are you doing this in the first place? Why do you want to become a nurse? What on God's earth would make you want to choose a career? Essentially, you're taking care of somebody else for 12 hours a day, and not just one person, but multiple people who may never thank you. I mean, that's the truth of the matter. I mean, why would somebody want to become a nurse? I don't know. But you have to figure out why it is that you want to do what you want to do. Is it your kids? Experience you've had as a child? Do you see nurses as heroes? Are you interested in changing your community or serving people? Like, you got to find your why, fortitude in yourself to say that I'm not going to let this failure stop me from progressing in my life. One thing about nursing is that once you get your license, it's a huge come up. Like, it's a huge come up in every area, financially, career-wise. Like, you can literally move from one income bracket to another one when you become a nurse. And I'm not saying the money should be the motivator, but certainly at a time like this, when people are losing jobs, when you see huge companies going out of business, billion-dollar companies going out of business, and you look around you, and the only industry that's really thriving besides the toilet paper industry, is healthcare, is people that are making health equipment, and so whatever your motivation is, you got to find it. So stick with us too. Okay. So yeah, that's what we're talking about. We're talking about passing NCLEX. We're talking about you can do it. All right. And you have to be willing to be all in. You have to be willing to be all in. I think, honestly, everybody on this broadcast has been through much harder stuff than the NCLEX. So don't let this test fool you to thinking that you're not stronger than it, because you really are. You really are. All right. Okay, guys. So I didn't want to keep you long. It was supposed to be a quick pop-up study session. So I hope to see you guys. In the virtual trainer, continuing the study process. All right. Can you renew your virtual trainer? Contact support, email support at Remar Review for all your specific virtual trainer account questions, because Team Remar will be able to help you better than me about your individual accounts, when you can renew, when you started it, things like that. I'm here to give you the studying. I'm here to give you what to study. All right. Team Remar backs me up on helping you guys get and things like that that you need. And so, yes, before I go, I have to say this. You can, you will, you must pass NCLEX. All right, guys. I look forward to studying with you again. This is a great time. This is a great time for us as nurses, okay? So keep studying. If you ordered your virtual trainer workbook, it is coming to you. While you wait for it, go ahead in the and get to studying, all right? You have a lot of time on your hands. The kids are quiet, so I'm kind of nervous about that. They've been quiet. They've been letting me study with you guys for quite a while. So I want to get back to being a mom now. We did our studying. Now we can get back to our regular life. That's what it's about, being effective, having power study sessions, and then being able to get with our normal lives. So I will see you guys. Thank you so much for studying with me and taking time out of your busy day. I appreciate that. See you later. Check out remarnurse.com. If you have any other questions for me about the products, you can find everything there. Also, turn on your notifications so whenever I go live, you will know that I'm live. All right. Bye, guys.